Hello, and thank you for joining me for this Practicum presentation. My name is Brian Walkowski, and my Practicum experience is titled Healthy Living and Weight Loss Outreach in a Rural Community. I'd like to provide some background for this Practicum. I am a physician and am currently employed as a general and bariatric surgeon at a rural community hospital in Western Pennsylvania. I serve as the director of bariatric surgery and the co-director of our hospital network's Weight Management Institute. Obesity is an area of clinical interest, and I have taken a number of steps to educate and involve myself further, including obtaining board certification in obesity medicine and obtaining my MPH degree with a concentration in nutrition from Liberty University. Next slide, please. This slide provides an overview of the Practicum experience. I chose the S&T Wellness Center as my Practicum site. This is a community public health center that is run by the local healthcare network with corporate sponsorship. Its mission is to promote overall wellness within the community by offering medically specialized fitness, nutritional, and health-related services to support individuals in their health and fitness goals. This center hosts a number of public health professionals who offer a wide array of community health outreach programs. These include, but are not limited to, nutritional support through grocery store tours, the Silver Sneakers program, and the Journey to Lean program. I chose Lori Smith as the preceptor of my Practicum. She is employed as a registered dietitian, and she brings decades of experience with respect to nutrition, disease, and community outreach. Her office is based at the Wellness Center, and she coordinates a number of outpatient dietary programs from this location. This Practicum was conducted from January to May of 2025. The Practicum topic was local obesity and weight loss resources. The scope was adults over the age of 18 living in Indiana County who are overweight or obese. I fully acknowledge that childhood and adolescent obesity is a concern within our community, but I wanted to limit the scope of this Practicum to adults. Next slide, please. My Practicum had 4 separate goals. Community members affected by overweight and obesity are often bombarded with all manner of weight loss options. These range from spurious fad diets to legitimate evidence-based programs led by specialists providing individualized weight loss support. My first goal was to run an online search identifying the medical, surgical, and behavioral weight loss programs and providers available locally. I then vetted these different resources according to a number of criteria, including professional affiliations, credentials, and outcomes. The second goal and deliverable of the program was to design and distribute a brochure detailing the capabilities of these local weight loss programs. I also included some information regarding obesity on this brochure in accordance with the health belief model. The third goal was to conduct a public health presentation detailing the various approaches to weight loss and some of the existing barriers to weight loss. The fourth goal of the Practicum was to present my findings of the online search to the local community healthcare needs assessment committee. Next slide, please. I will touch on the Practicum methods here briefly, but they're covered in depth in the Practicum final paper. I used an online search using keywords and Boolean operators to identify local weight loss programs and performed an in-depth analysis of each of these weight loss programs. For the brochure, I designed and developed a deliverable in conjunction with the regional marketing director of the local hospital. I compiled all the resources that I identified in the previous goal and incorporated them into a brochure along with some basic information related to weight. I then surveyed community members regarding the readability and utility of this brochure and elected not to change any of the content or formatting based on their positive responses. I delivered a 1-hour public health presentation that was given at the Wellness Center. I asked for the input of some of my colleagues regarding their areas of expertise in the fields of nutrition, bariatric medicine, and mental health. All visual aids and slides were designed in accordance with the health belief model. The fourth goal was achieved by having an informal meeting with several key stakeholders of the local community health needs assessment committee. I discussed with them the resources that I had compiled and presented the brochure. Next slide, please. I will touch briefly now on the results of the Practicum goals. The online search using the parameters that I discussed earlier was performed, and I was able to identify several viable medical, surgical, and behavioral weight loss programs available locally. These resources were incorporated into the brochure. I conducted a 1-hour public health presentation at the Wellness Center in March. It was advertised on the Wellness Center's social media. It was also shared with the members of the local hospital's weight loss support group. The presentation was well attended by local standards. There were 35 adult participants. They were all invited to take a survey on the clarity, goals, and utility of the presentation. Participants also had the opportunity to ask questions at the conclusion of the presentation. Finally, I had an informal meeting with several members of the local community healthcare needs assessment. I discussed my findings with them and presented the completed brochure. Next slide, please. The first goal of vetting the local weight loss resources was an important aspect of the practicum. I find that many of the patients who come to my office for a consultation are confused by the weight loss options that are available to them and which of these are viable. Unfortunately, many healthcare providers are unaware of these options and can't counsel their patients appropriately, which compounds the problem. People are confronted with different dietary approaches ranging from very low-calorie diets and carbohydrate-restricted diets to green tea and cabbage soup diets. They are confronted with a number of dietary supplements which are not evaluated by the FDA and make promises to burn fat, boost metabolism, and curb hunger. They see the numerous commercials on TV advertising the latest anti-obesity medications and learn from their friends and family members who are undergoing weight loss surgery. I wanted to remove some of this patient burden by compiling these resources and discussing their pros and cons in an interactive setting. A good study often poses as many questions as it answers, but I would like to investigate utilization rates of these resources now that these brochures have been made available to the public. More importantly, would this translate into lower BMIs within the community and by extension, healthier people? The Community Health Needs Assessment Committee meeting was also very productive. I had the opportunity to discuss some of the barriers to healthy weight management in our community and what some other rural communities across the country have done to combat them. Next slide, please. This practicum was a very rewarding experience because I got to interact with community members affected by obesity outside the walls of my bariatric surgical practice. I was able to glean some insight as to how people perceive different weight loss options and how they decide between these options. The community presentation was an excellent opportunity to discuss my area of expertise, integrate the expertise of my colleagues, and then listen to the types of questions that the community members posed. The presentation ended up being a great discussion where we addressed everything from anti-obesity medications and dietary supplements to insurance qualifications for weight loss surgery. It was also very rewarding to work alongside with my preceptor, Lori, as part of her normal outpatient dietary practice. She was able to synthesize complex dietary concepts and regimens into workable dietary approaches that people, irrespective of their backgrounds, could easily employ in their daily lives. I've integrated some of her approaches into my patient dietary counseling as a result. The practicum was also important for perspective. I only see patients clinically once they've hit rock bottom, so to speak, as a result of their weight. I got to see them as part of the practicum and focus on preventative care. I was also able to think on a community rather than an individual health level. This is important as many of the challenges of obesity lay within the realms of public policy, socioeconomics, and public education. I found it challenging to coordinate the details of the public health presentation at the Wellness Center. Even simple presentations require logistical, facility, marketing, administrative, and clinical support. Thankfully, the Wellness Center was able to help coordinate all of the details needed. I believe that the best aspect of the practicum was that it allowed me to establish presence and standing within the local public health community. It seems that clinicians with an interest in public health are relatively few and far between, especially in rural areas. I have been invited to participate in the next community health needs assessment that is attended by local public health figures, politicians, educators, local business owners, and a bevy of other stakeholders where public health problems are defined and potential solutions are framed. Next slide. That concludes my presentation. I'd like to thank you for listening.